My name is Andrew Wong. I'm an OT student at NYIT for Psychosocial Assessment class. The purpose of this video is demonstrating an example of two OT assessments for a case study psychosocial patient. So the case example we had was Mr. LZ, and the two tools we used was the COTE, the Comprehensive Occupational Therapy Evaluation Scale, and the COPEM. So we picked the COTE. This is what the form looks like, because we wanted to evaluate the behaviors of Mr. LZ during his tasks and with other people. So for Mr. LZ, we created an intervention plan with different goals, strengths, barriers, assessments. So Mr. LZ's strengths include good social support. His family is very helpful, and they make sure that he gets the best opportunity to to go to the treatment center. He also has intact orientation, so there is nothing wrong with his ability to know where he is and what time and day it is. Some of the barriers Mr. LZ has is he has no energy and motivation. Every day it's kind of a drag to him, and he also has poor communication skills. He has a flat affect and speaks very slowly and quietly. He also has poor attention to appearance. He shows up to the session with wrinkly clothes and unkempt appearance, unshaven. So the goal that he specified was that he wishes to have fun with himself, friends, and also to look good again. So the three areas of occupation we decided to focus on using this tool was social participation, leisure, and self-care. So one of the supports that in his areas of occupation is the context and environment supports his social participation. The day program that he's currently at allows him to interact with people and to make more friends. Currently, right now, in his case study, it says there's one man similar to his age trying to make friends with him, so that's already one way it supports. One way an area of occupation hinders his ability is self-care, as his self-esteem takes a hit, as evidenced by his lack of self-care, lack of confidence in his appearance. One long-term goal that we developed for Mr. LZ is he will participate in movie watching and computer game playing with 2 to 3 friends for 3 to 4 months. He described that these are the activities he enjoys doing, and he wishes to do these activities again with friends. So we created this goal for him to do over a long-term span and with a few friends just to start out. We developed 2 short-term goals for Mr. LZ. The first one was he'll appear clean and well-groomed every day for 1 week. The rationale behind this was to keep his appearance and self-esteem higher up. Generally, you feel and look better when you're cleaner and well-presented. The second short-term goal that we created was that he'll speak with clarity and show expression in his conversation within 1 week. That can help us. The assessment will help us COTE in this goal because we can see how he expresses himself with others, doing tasks, and with other people. So we want him to speak up more, be more expressive in conversation, and we hope he can do this in 1 week. So To elaborate more on the coat, the completed form kind of looks like this. We want to evaluate how Mr. LZ talks, how long he talks with people, and the way he expresses himself to make sure it's appropriate. People can hear him, like the clarity, and how he interacts with others. The main reason why we chose this tool is really to find all the problems he has with other people and with his tasks. If he can keep his attention, coordination, problem solving, following directions, these different facets allow us to explore what we can work on, and also potential strengths he has. Like I was mentioned, he has no issues with orientation, so that shouldn't be an issue. And he doesn't appear to have any issues with being on time or being disruptive to others. We just want to know what's holding him back from doing what he wants, which is to look nice and to do the activities he enjoys. So this is just one tool that we're using. My partner is using another tool. So our concluding statement really for Mr. LZ is that we want him to work on these goals to show improvement in 3 areas of occupation: his self-care, social participation, and leisure activities. So these are the 3 things he mentioned. He wants to look better again, his self-esteem is kind of low, and he wishes to look good again, like he's very capable of doing, and he lets us know that he used to look good and he wants to look good again. He also wants to go back to the activities he likes doing, which is playing computer games and watching movies. And lastly, social participation. He wants to go back to making friends again and to not do things alone all the time. So to continue on with the conclusion statement, Mr. LZ should be able to feel good about his appearance and time spent with friends with a few months. So that is our conclusion statement for his treatment plan. These 2 pages, as I read before, they have all his goals, his strengths, his barriers, and the purpose for us, the OT, is to look at what he wants to do and different things that might hinder him from doing that, and things that will help him, which we can use the coat for to find different behavior issues or strengths within the tasks that he does and interactions he has with other people. So to sum it up, this one tool we picked for Mr. LZ is the COAT, the Comprehensive Occupational Therapy Evaluation Scale, and we came up with 3 goals, 1 long-term, 2 short-term over here. And the 3 areas of occupation we wanted to focus on was social participation, leisure, and self-care. So that concludes this treatment plan and tool evaluation for Mr. LZ.